Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us today. Going to have a conversation with Mr. Jayson Yardley, CEO of Avadyne Health, and he's joining us on the program this morning to talk about his new book, Rev Up, that was just released last month, where he shares some strategies for hospital leaders to reduce the cost to collect, increase collections, and to improve the patient financial experience overall. Welcome to Health Professional Radio, Mr. Jayson Yardley.
Thank you, Neil, and thank you so much for having me on your program.
Okay, I did mention, of course, that you are CEO of Avadyne Health. Talk about your background. Give us a bit of your background, and what is your role there at Avadyne?
Yeah, I have had the pleasure of working in the business of healthcare, primarily focused on hospitals and health systems for over 25 years, both in hospitals and health systems, in consulting roles for over 10 years, and for the past 12 years, I've been in various forms of managing or outsourcing the revenue cycle of hospitals and health systems. And at Avadyne, we partner with hospitals and health systems to manage the patient financial experience. So that means both before and after services. We provide self-service and assisted solutions, both in the billing and follow-up of patients through our call centers and technologies. And we really help to try and drive the reduction of the cost of healthcare, increase financial performance, and empower a great patient financial service for all of us.
You're talking about the financial experience of the patient. How involved in the actual patient's experience is Avadyne as opposed to the facility's favorable outcome and efficiency?
We are incredibly involved in the patient's experience, and specifically the financial experience. So if you think of an overall experience that a patient will have when they engage with a hospital or a health system or a physician, they have both their financial experience as well as their clinical experience. So before they have their clinical experience, we are able to provide solutions and services before that to help them understand what liabilities they might have, what they might owe, what their insurance might cover. And then after they've received care, we provide both the billing and follow-up solutions for the hospitals. We have call center solutions. We have technologies that engage both in the call centers as well as even doing some fun things with speech analytics and augmented reality.
Would you say in your experience that I guess one of the main issues is patients simply not understanding what the bill is all about? What's it saying? Why am I being charged for this? I wasn't charged for it last time. Some of those hidden costs maybe are not so hidden, while some of them actually are hidden. When it comes to understanding, is it more the patient, not understanding some of these astronomical costs? And how much do the leaders of the hospital understand how they're collecting, how they're billing, and why?
Yeah, there are really opportunities on both sides of the fence there, if you will. There are some hospitals and health systems that do a great job of providing not only a great patient experience, but understanding ultimately what a patient is going to owe and sharing that information in a way that patients can understand. And there are many hospitals and health systems that struggle with that, both from a process and a technology perspective. But then patients also have a responsibility, and my number one recommendation to patients is really to be an advocate for themselves, to be as focused on the financial outcomes of receiving healthcare services as they are on the clinical outcomes. And there's a number of things that patients can do to really support that, whether that's educating themselves on their own insurance coverage, their copays or deductibles, what's in network, what's out of network, asking providers about all of the different providers that might be engaged in their healthcare services. So that includes the hospital, any physicians, and any physicians they might not be initially aware of, like anesthesiologists or hospitalists or labs. And after their service, calling in and asking questions. Every hospital and health system has call centers and opportunities for them to reach out and to obtain answers to the questions they might have. And they also need to understand that hospitals have many programs to help patients, whether that's through setting up payment plans or offering financing options or even charity care options if a patient isn't able to pay.
Would you say that the time-consuming task of asking the right questions, doing your due diligence when it comes to your either anticipated care or the care that you may be in the middle of, why is it so complicated? It should be, straightforward. Does Avadyne throw all of the excess information to the side and give the patient and the hospital the meat of the situation to be more efficient when it comes to collections? Or do you leave it to both those institutions or both of those entities to kind of fend for themselves and you just set up the system in place?
Well, we help provide the information that patients are looking for and to make it consumable in a way that helps them through the process. So we've done an incredible amount of research and business analytics into patient payments and patient liability resolution. And interestingly, we've found that of all of the patients that make payments, almost 50% of patients will call in at some point or initiate a chat or ask questions about their bill or ask questions about the amount of monies that they owe. And I think that just speaks to how complicated our healthcare industry is and how complicated the insurance component is, the billing and collections component of it is as well. And so what we've found is if we can provide a great patient financial experience, a great consumer experience, if we can answer those questions, then we're able to help patients resolve whatever liabilities it is that they might owe. And as a result, both help reduce on the cost of providing those services to the hospitals, but also to help drive their financial performance as well.
Some healthcare procedures require that patients have a certain medicine or a certain machine across the board. Sometimes that medication, that treatment may not be necessary in this particular patient's situation, even though it may be in many others. How can a patient avoid being charged for things that they don't really need in their specific case?
Well, it's a little bit more on the clinical side of this, but once again, I'll go back to just saying I really think that patients need to be advocates both clinically and financially for themselves and understanding and having that open dialogue with their physicians and with anyone else they engage with either at a hospital or outside of the hospital experience to both understand what it is that they're either being prescribed and the appropriateness of that in a clinical setting, but then also to understand the financial implications and whether or not, for example, something is medically necessary, and if that's going to be covered under their healthcare insurance, or if it's going to be something that ultimately they're going to end up being responsible for financially.
Now, in your book, Rev Up, how much does it talk about, I guess, concierge types of services when it comes to financial? We hear a lot about concierge medical, picking and choosing what you need specifically. But when it comes to paying the money or collecting the money, how does that fit in? And is it discussed in your book? The concierge concept is discussed in the book. And just to be clear, there is a medical concierge concept, which is not what I'm referring to. What I'm referring to is from a financial experience, patients are really looking for an experience that's more consistent with a positive retail experience. And from that, they're looking for, and this is what I refer to as the concierge service from a hospital revenue cycle or from a patient liability resolution perspective, is patients are looking for continuity. So they're looking to have the same experience around people, process, technology, and the billing process throughout their engagement with either a hospital or a physician. They're looking for help from someone who really understands the healthcare process, really understands their insurance and billing that they can engage with. They're looking for simple and easy to understand bills. Prior to service, they're looking for an estimate around what it is that they're going to owe, and ultimately some level of either control or personalization around how information is presented and delivered to them, whether they, for example, want a bill to receive it electronically or to receive it in a paper manner. Would you say that you are on the fast track to kind of changing the face of medical collections? I believe so. I believe so not only through some of the great things we're doing from a people perspective and the education and the training that we provide to really deliver that concierge experience, but also working on some really interesting new technologies that includes building patient portals that provide those price estimations and ability for patients to engage both before and after services.
We have built and are working through some speech analytics tools that actually listen to the words that are spoken, automatically transcribe those spoken words into written words, and then we run hundreds of rules against every word that's spoken. In fact, last year we measured and scored around 1.5 billion words, and what that allows us to do is to identify whenever a patient is using words of escalation or words of frustration. It helps us to provide that better patient experience and to work with our hospitals and our client partners to identify where there might be breakdowns in the process that we can improve anywhere along the process. And then lastly, we've done some fun things to both provide one-of-a-kind patient financial experience scoring, as well as we've built the first of its kind augmented reality patient concierge tool, which is an app that patients can download. They literally hold their phone over their hospital bill, and a three-dimensional character stands up out of their bill and helps explain their bill to them. So I think we're doing some really fun things from a technology perspective, and we've been able to leverage technologies from other industries like the entertainment industry and bring some of those now into healthcare, which is not only a lot of fun, but I think it's providing a lot of benefit.
It seems as though you're building trust, satisfaction, and transparency all at the same time, something almost unheard of in huge industries such as healthcare. We
certainly are trying to, and I think you could not have used some more appropriate words, and patients are really looking for both that price transparency to understand what it is that they're going to owe, as well as they're looking for some measurement of quality, and that will really just transition healthcare to acting more like other industries where any consumer has an idea around what a service or product is going to cost, what the product is, what the competitive environment is of that. And by providing that, we develop trust and hopefully ultimately loyalty to our hospital and physician partners and clients.
Where can our listeners get a copy of Rev Up?
So you can, your listeners can go to the internet to obtain a free PDF copy. They can go to revupbook.com. That's REVUP book.com. Or it's also available at all major book retailers, Amazon and such.
Great. Jayson, thank you so much for joining us on the program this morning, man.
Neil, thank you so much for having me. I really enjoyed it, and thanks so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Jayson Yardley, CEO of Avadyne Health. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and visit our affiliate page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.